Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County. Today is February the 23rd, and we'll do our Facebook Lives. This is our chance for you to get your questions answered. We already have a couple of people who put them in on Facebook questions at douglaspublichealthnetwork.org, but you can put them in the chat section, and we'll try and get to them today. There's lots going on, so we'll try and get to as many as we can. If not, I will answer them tonight. So as always, we start at the world view and then move down. In the world, we're at 112 million cases and 2.5 million deaths. A lot of deaths. Although, as a student of history, I look back to the Spanish flu pandemic, where probably somewhere between 15 and 50 million people died in a much smaller world at the time. So while this is huge, it's a lot less. Although I will point out that death back at that time was really seen very differently. People died young, they died early. Somebody dying in their 30s, 40s, and 50s was tragic, but really quite expected. So very different now. So I'm now reading about Lincoln, and Lincoln really had lots of death in his family. He lost his mom and a sibling, and then one of his children, and then another of his children, and so death at that time did affect people, but death was much more a part of life. Now we don't really expect to die before we get into our 60s, 70s, or 80s, and these 2.5 million deaths are really racking our country. Racking the world. In the U.S., we're at 28 million cases and 500,000 deaths, and we had some ceremonies yesterday commemorating or marking those 500,000 people who died. 500,000 deaths is a lot. I mean, it is more than the deaths in World War I and World War II combined. For last year at 500,000 deaths makes it one of the leading causes of death in the country. So every year about 600,000 people die of heart disease. 500,000 people have died in this last year of COVID, and not that many died until later in March. So it really is quite the pandemic. But the good news in the U.S. is the number of cases are down, the number of hospitalizations are down, and the number of deaths are definitely down. Still active in the U.S. in places like the Texas Panhandle, I don't know why, South Carolina, and in New York. South Carolina is especially concerning because South Carolina is the place where we've seen some of the South African variant. And the variant stuff is very slow. So we send the variant stuff out. We don't get the results back for 2 or 3 weeks. So, whether any of the uptick we've seen in the last 2 or 3 weeks is related to a variant, we won't find out until next week or the week after. And so it's very slow and really a lagging indicator. And in the U.S., we're just now building the genomic analysis so that we can really look at these new cases to see if they are variants. Oregon overall is quieting. So much of the I-5 corridor, which had previously really been ripe with the disease, is now down. But Douglas County, which has really been open, we've had restaurants open, bars open, gyms open, schools open, is really now starting to see some of our worst time. And last week was our worst week ever for the number of cases. So we've had 300 cases over the last 2 weeks, one of our worst times ever. And where is this coming from? Well, it's coming from everywhere. It's not just North County or South County or Roseburg. It's everywhere, all the way out to Reedsport, north as far as we go, south as far as we go, and then Roseburg in between. It's in nursing homes, so that we have a couple of nursing homes where there are cases and continuing to have cases. The nursing home that had the large outbreak is continuing to have new cases, although that is slowing down. We're seeing it as school-related functions. Now again, school-related functions are not really in school itself. So as I've said before, I don't think we're seeing much passage or any passage between this kid in class and the next kid in class, or between the teachers and the kids. And there could certainly be some passage in some places, but we really haven't seen that. Mostly what we've seen is teachers passing it among themselves as colleagues, or students spreading it to other students outside of school. So one of the things that happens at school is kids plan parties. Younger kids, sleepovers and birthday parties, older kids, parties. And then kids who do sports get together before and after sports to play video games, go out for a meal, go for a drive. And that's where we think it is spreading. We're also seeing a lot of workplaces. And again, in the workplaces, it doesn't seem to be when people are at their workstations, but rather seems to be when people are gathering during breaks and lunches. And we know when we talk to these places that people are not good about wearing masks, not good about distancing during those break times and during those lunch times. So we're seeing it all over. And this high number has now brought us into the extreme range. It was announced today that in the extreme range, we're going to have more closures. And so the commissioners made a very nice statement about that today, and I would direct you to that. So the first question we have is, are we going to the extreme level? What does that mean for local businesses? So it's a complex thing what it means for businesses. I think for restaurants, for example, it means takeout rather than in-person dining. For bars, it means takeout rather than in-person services. Now, for some restaurants, they can do fine with just takeout, but for some restaurants, it's going to be very difficult. And for bars, that's also going to be very difficult. Okay, so Pauline says, I thought I had a good understanding of the vaccine prioritization, but my daughter's 48 has a long-standing TBI disability. Is she eligible now for vaccine? Very complex question. And it's like a 5-part question as to whether she would be eligible. If, for example, she was a healthcare worker, she would be eligible. If she was an educator, she would be eligible. As somebody with a disability, she would be eligible, and it's really parsed if she is considered to be medically fragile, and medically fragile would mean that she's getting daily skilled nursing care or in-home care. And so it's really fact dependent, and I would have you specifically call and we can look and see. So Janae, I think that's how you say it, directed me to you. My husband and I are over 70 and want the vaccine. How do we get signed up? So our plan for vaccinating seniors is the plan actually that Oregon is going to adopt in the future, but as we're already doing it in Douglas County, is that you should get your vaccine where you would normally get your health care or your flu vaccine. So you should call your doctor. We have about 40 different vaccinators in the county who are giving vaccine. And so you should call their doctor. And so for about 90% of the people 80 and above, they have that, they have vaccine and they can give it to you. If you don't have a provider in the town, you should. But if you don't, then you can go to one of the pharmacies, and Albertsons, the Albertsons Safeway on Stevens, Costco, Weimar and Sutherland, Winston and Roseburg, and Gordon's Drug in Canyonville, and Fred Meyer's all have vaccine. So if you would normally get your vaccine at one of those places, either your doctor's office or those pharmacies, you should give them a call. Now the problem is there's not nearly enough vaccine for everybody who wants it. So, there are 20,000 people who are seniors who are eligible, in addition to all the educators and all the other ones in 1A. And, we don't have nearly enough vaccine. And so it may be a wait to get the vaccine, and you are clearly eligible. There may be a wait, but we're trying to get out there as quickly as possible. So, Amy says, do RA drugs help with COVID? It's kind of interesting. There's one of these drugs called Actemra, which has actually been studied in combination with remdesivir and does seem to help with people who actually have the disease. Whether the RA drugs help to prevent the disease, there's no data yet on that. Do they make you more likely to get the disease? We don't know that either, but we do know that if you actually have the disease, that Actemra actually is one of those things that has been shown to be a mild help. Vicky says, what's the source of all those cases today? It's everywhere. There were school cases, there were new workplace outbreaks, there were some more from the nursing home, there are a bunch of sporadic cases. They are coming from everything. We're seeing now people who went to Super Bowl parties and people went to other gatherings. So one of the big questions is, well, what about restaurants and bars? Well, restaurants and bars, say let's take restaurants, their job is to go ahead and make and serve food. It is not the making and serving food which is the issue, it's people gathering. And it's the gathering which is really the issue. Some of these gatherings have actually happened at restaurants or bars, Many of the gatherings have happened in the kitchen or the living room, and it's not the fact that you're eating in a restaurant, it's the fact that people are gathering, being close to each other, not wearing masks, and gathering households together that cause the problem. So, for example, we heard about a wedding this weekend where there was a positive case and the people in the wedding got exposed. And again, whether that wedding was in a restaurant or outside or in a convention hall, it really doesn't make a difference. It's the fact that we gathered together 50 people and had them together without wearing masks where this spreads. Now, obviously, having restaurants and bars open, people may gather there, but if you close them, then people just may gather around the kitchen table. So again, when I look at it, it's not necessarily the venue, it is the behavior. And the behavior is mixing families for a long period close together without masks. Stacy says, I want the vaccine, but my friend is on the fence. Is there any data showing lingering side effects after the second dose? So especially with the Moderna vaccine, after the second dose, it is not uncommon for people to have side effects. Achiness, very sore arm, fatigue, sometimes headache, sometimes fever, sometimes chills. That almost always goes away by the second or third day. I know of no data showing lingering side effects from either the first or the second dose. Last time we had a question about this COVID nicotine study. And so this COVID nicotine study showed that in France, the proportion of people who were in the hospital who were smokers seemed to be lower than expected. And someone said, well, maybe nicotine helps. And people look and say, well, that's crazy. And I don't think we should ever dismiss anything as crazy. So I'll give you a little background story here, as I want to do. So about 20 years ago, what they recognized was people who took care of a disease called ulcerative colitis. So ulcerative colitis is a disease where you have bloody diarrhea and abdominal pain, really a nasty disease. And what people who took care of this found was they had almost no smokers in their clinic of people who had ulcerative colitis. And in fact, there were a number of people who decided they were going to make themselves healthier, stop smoking, and then wound up with ulcerative colitis. And when they went back to smoking, their ulcerative colitis got better. They said, that's weird because we don't know of anything that where nicotine makes you better. But indeed, it does appear that nicotine does help with ulcerative colitis. And in fact, for a while, they were talking about giving nicotine enemas for that. There's other stuff now which is much more effective, so they don't do that. But it's very clear that nicotine did actually help with ulcerative colitis. I think the only thing that nicotine helps with. So it's not totally unreasonable to think that nicotine might help with this infection. It's like all science. What you should do is you have this observation, just like Fleming had the observation that the bacteria don't seem to be growing around that penicillin mold, and then he came up with the idea for penicillin, or many people who figure out other kinds of things by making an observation and then testing the observation. So they are doing a test now, and it's in clinicaltrials.gov, where they're trying nicotine replacement therapy, the nicotine patch, for COVID to see if it works. So far, the data is not very hopeful that it's going to work. But the only way you know these things is to try these things. And if you try them and they don't work, like hydroxychloroquine, you should just get rid of it. And if you try it and it does work, then you should look further. Again, in this world of hunches, most of your hunches aren't correct. So if you do any kind of thing, puzzles or whatever, you think, oh, I think I might have it right. Oh, that doesn't work. And people are doing detective work. They have a hunch that maybe this guy did it. He's looking a little shady. It certainly doesn't always play out. And certainly in medicine, it doesn't always play out. So maybe if hunches, 5%, 10%, 20% of your hunches work out, but certainly not all of them. So this person had a hunch that nicotine might work, and that's it. A couple of things that I would also point out. So you have to say who's doing the study. Do they have any vested interest in getting this? Well, the guy who wrote the nicotine thing works for the tobacco company, so maybe he had a vested interest. And the second is, has it been peer reviewed? So what peer reviewed means, you put it in there and other scientists look at it. They say, well, did you correct for this? Did you correct for that? Did you see this, that, the next thing? What did you use as your endpoints? And then they either tell you to fix it, or they say, I don't think this is good to go. And that peer review is very helpful because these are people who are scientists who knows what goes on. So another story early on in this thing, there was a story that people lost sense of smell and taste with COVID. So what we did one day when we did the testing is we had people smell a cotton ball that was dipped in orange essence to see if they could smell it. And what it showed was that at least at the time, all the people who were positive for COVID could smell the cotton ball, and none of the people who couldn't smell the cotton ball were positive. So it looked like it worked. However, when I submitted this to the New England Journal, the peer reviewers said, well, the problem is there were a number of problems with the methodology, and I agreed with it, and so it just lay there. And so with this COVID nicotine study, I had kind of a vested interest in making it work, and it wasn't peer reviewed. So those were two things that make me look a little bit askance when people write that. So there's an ongoing study. It's in clinicaltrials.gov. They stopped recruitment in December of 2020, so we should know within the next month or two whether nicotine helps or not. And if it does, put a nicotine patch on. It turns out that with smoking, there are two harmful things. Nicotine is probably not great for you, but far and away, the risk of smoking is from the smoke itself. So if you use nicotine replacement therapy as either nicotine gum or nicotine patch, it's probably not the greatest thing for you, but not very harmful. What's really harmful for you is the smoke. Another question is, how long is the vaccine going to be effective? I was on a conference today about that. It's pretty interesting. The people think there's been a very good T-cell response. And by seeing the good response after the second dose, where antibodies go up after the first dose and then really go up after the second, suggests that your T lymphocytes, those are lymphocytes whose job it is to recognize an infection early, seem to be very attuned to this virus. So it's thought that this vaccine could be effective for a while. People thinking at least a year, somebody was saying 10 years, and there was even somebody who was suggesting that it could be a lifetime. So that would be good. I had a question about the flu season this year. Tell me what's happening with flu. Well, flu is almost non-existent this year. So every year there's hundreds of thousands of cases of flu. This year at the CDC for last week, they had 25,000 samples for flu, and only 14 of the 25,000 were positive. Usually it's 30% or 40%. This was 14 out of 25,000, less than 1 in 1,000. Usually for flu, there's 100 to 200 pediatric deaths a year. This year there's 1. Every year there's typically hundreds of admissions up in the Portland hospitals for something linked to flu called respiratory syncytial virus, or RSV. They've had none. And so the question is, what's going on here? I mean, how could it be that both RSV and the flu are so low this year? And here's the answer. So when you look at how a disease spreads, you take what its native contagiousness is, and then you diminish that by the number of people who are immune to it, and then diminish it by what protections you are using. So flu has a normal reproductive number of, say, about 1.3. That is, one person normally infects about 1.3 other people. Well, this year, about 1.8 million people in Oregon, so about a third of the population in Oregon, have been vaccinated against the flu. The flu vaccine in a good year is 50 to 70% protective. So there probably are about 20% of the people in Oregon who are protected by the vaccine. So you take the 1.3, multiply it by 0.8, now you're just at about 1. And then by people wearing masks and social distancing and staying home when they're sick, it goes down by about another 30%. And so now your R for the flu is well less than 1, which means that it's not going to spread, and that's why it's gone. However, when you take COVID, its R is likely between 3.5 and 4, so 3 times as contagious. Whereas we think about 20% of the people are probably not susceptible to flu. The numbers in Oregon now suggest only about 5% of the people, before we did the vaccine, had antibodies. So you multiply, say, take 3.5 times 0.95, you're still well over 3. and then you put in the masks and diminish it by a third because masks help, and you're still at 2, meaning that it's going to still spread. And that's why what happens during a time when you're using masking and distancing and whatever is the less contagious diseases like flu and RSV go away, but the more contagious diseases like COVID continue. So we had a question about who are the new vaccinators. So this week we've added Dr. Seals, we've added Albertsons, we've added Costco. We're hoping for a few more pharmacies that we can tell you about the next time we meet. So we're getting more and more people signed up to be vaccinators. So Bruce says, how does the extreme lockdown control the sorts of outbreaks we saw over the last few weeks? Well, again, the lockdown stuff that we do by closing restaurants and bars hopefully gets people to think that, wait a minute, it's not time to do these gatherings. Maybe when we go to extreme range, parents say to their kids, look, this is not the time to have a sleepover. And so it's not the specific things that we do. So it's not the specifically having fewer people at the gym, because we don't think we've seen a lot of spread at the gym. But when I know from talking to kids every day that when they were online school, they had very few parties and sleepovers. Now that was hard on their mental health, but they had very little of that. Now that kids are going back to school, they're seeing their friends, they're going over to friends' houses or sleeping over. So it's not the specifics of what you do in the lockdown, it's the idea that people are getting, this is really a problem, we should stay home. So for example, if people said, okay, we can't go to restaurants, we're going to have just as many parties, but have them around my kitchen table, that's not going to do anything to the disease. But perhaps people recognize, there's more disease now. We're not going to go to a restaurant, but we're also then not going to have a dinner party. So I think it's the behavior rather than the specific lockdown things we do. So Greg says, my wife is 65. When can she get the vaccine? Starting next week. And where? Again, she should get it at her regular provider. Again, most of the providers in town, most of the people who are being cared for in town, get vaccine and have vaccine. If she does not have a provider in town, she should think about getting one. And where should she get it? She should get it where she would normally get her health care or where she would get a vaccine. So Veronica said, did the residents and staff at the nursing home that were vaccinated get the virus? The answer is complex because none of them were 14 days after the second dose, so none were fully vaccinated. So most were probably exposed about the 1st of February, and they had gotten doses on the 6th and the 27th. So most were just a few days out from the second, some were just a few days out from the first. So it's a little complicated in doing that. But what we did show was that those who were not vaccinated almost all got infected. Those who were vaccinated, very few got infected, and we're going to figure out the full numbers when that outbreak is over. So Jedediah said, have we started getting our full vaccine allotment? And the answer is yes, that over the last 2 weeks, they have changed the vaccine allocation formula. So in the beginning, when we were just starting, the state was mostly allocating vaccine to large events, Oregon Convention Center, the airport, Salem Health and the Fairgrounds, Asante, St. Charles, big drive-through at Peace Health. And so it went to the major population centers in the state. The idea being, well, that other people will just seek these population centers. Well, it turned out that was not true, that almost all the vaccine they were giving for people in their counties. And so that there was a real imbalance then between those counties that had the big health systems and those counties like Douglas County that does not have one of those big healthcare systems. So they recognize that, they've changed it. We are now going to be getting 2,500 new doses per week and then second doses to follow that. That is just about relates to the population of seniors in Douglas County. So I think at this point we are going to be getting our full allotment and we'll catch up to the rest of the state quickly. So if you look at the numbers that have been vaccinated, Douglas County now is not near the top. We're sort of near the bottom, but not the bottom like we were in the past. Plus, the numbers that the state has does not count the 3,000 or so vaccines that have been given to the VA. Kind of complicated reason. Since the VA gets their vaccine from the feds, they report the data to the feds and not to the state. So so if I'm a veteran, if I'd gotten my vaccine at Aviva, which I did, it gets counted in the state numbers. However, as a veteran, I could have gone to the VA to get it, and it would get reported to the state, to the feds, but not get reported to the state, so it would look like I didn't get my vaccine. This is the craziness of how we do healthcare in this country. And when we get done with this, we got to fix this. And I asked today that question of the state, and they said, oh, we're working on it. In 7 months, we think we might have that data. So 7 months from now, we won't really care about that data. But that's the problem. So when you put those numbers in there from the VA, we're right like smack dab in the middle of the state. So a friend's daughter is in quarantine because of a bus exposure. If the bus driver is positive and wearing a mask, and the kids are wearing a mask, why be quarantined? So this whole question comes to about how you do quarantines at school. So the way we do quarantines for people who are not at school, say you're at a workplace, we carefully interview the person and we say, okay, you had symptoms on Friday. So we consider that you were contagious on Wednesday and Thursday. So let's say it was me, and they say, well, Bob, today's Tuesday. But let's say you say, Bob, what I was doing. So on Monday, I did this. I don't think I had any exposures, but yeah, then we had this meeting. Yes, these were the exposures. And you can figure out about each of the exposures. And so then what they do is they'd list those exposures, average of 5.5 for an adult. And then you would call those 5.5 people, or I would talk to them and say, hey, remember we had lunch that day. It turns out now I'm positive, so I may have exposed you. And then they would need to be quarantined. With schools, it gets really, 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 really complicated because, at least until you get to high school, asking a kid what happened 2 days ago is useless. I mean, ask your kid what they had for lunch at school, and you'll find that, time is such a different thing for kids. So it is really, really, really hard to go ahead and know about exposures. Now, bus is the one place where we actually have video, and we frequently watch the video to see if people have exposures. But buses tend not to have good ventilation, and so they spread. And we know that from studies around the world that buses, even when people wear masks, are really a place that spreads. So we review each one of these individually to check. What we do not do is interview the kids and everybody in class and say, hey, were you around Billy last week and whatever. It is way too hard to do and pretty useless, because when you ask your kids 2 days ago, were you around a certain kid in school? And so it's going to be really hard to know. So in Oregon, as in most states, what we do is we find out which cohorts or which pods the kids were in. And so, for example, a kid may be in the bus pod, so they may be in bus 43 pod, and then Miss Jones' second grade pod. And so if that kid then is positive, every kid on the bus and every kid in the class is quarantined for that time. And that's why we like small pods, because then you don't have to quarantine very many kids. The problem is we've seen kids in the bus pod, and then in the breakfast pod, and then Mrs. Jones' pod, and then the after school activity pod, and then bus 41 pod. And so they have a lot of people that then get exposed. But we're following basically the state and the federal way of looking at exposures. Now, bus exposures are the one where we actually have video, and we're frequently able to exclude kids on the bus because the video shows that they weren't together for very long and people really were wearing masks. In class, we have no way to know that. So Linda says, I'm 74. County recommends signing up with my medical provider, yes. And my provider says to sign up with the county. Well, so your provider's mistaken. So Linda, if you'll send us another specific note, we'll tell me which your medical provider is, and then we'll figure out how to do that. So the number of people tested each day is no longer available on the news release. Yeah, so the testing is very complicated now. So in the past, So early on, when we were doing this and looking at the number of negative tests, we were doing tests in one way, which was the nasal PCR tests. These were getting sent to the state, to a state laboratory. And so you could know what both the positive and negative rate is, and we could see what the rate of positive and negative tests were. That then made it really easy. The problem now is that you can get tests in so many ways. Right? You can go still to the fairgrounds and get your test on Friday and get that done. That's done in the way it was done before, but you can go to Rite Aid and swab your nose. That gets sent to New Jersey and gets sent back. You can spit in a cup. You can buy it at Costco, spit in a cup, send it off, and that comes back in a way. You can go to one of the clinics and get a Binax test, and that's reported all in a different way. And so reporting the number of negative tests, which previously was very easy, is now extremely complicated. And again, I was on another long conference today where we were talking about how we're going to do that. And the state has figured out a way to do that. But the number of negative tests is so enormous at this point that they're just calculating a percentage. So when I looked at our percentage today, I think we were at 6.4% positive. And so you could do the math and figure out what the denominator on that is. But it's a very, very, very complicated story because of all the new ways to get testing. So yeah, it was a lot easier back in September when there was just a single way to get a test, but it was not a better time because it's so much better now being able to get tests in multiple different ways. And it's so much better now to be able to do these rapid tests. So Chad, it's good that you say that, but it is confusing. So Denise says, do you think we should avoid taking Tylenol before or after the shot will reduce the efficacy? So this was another thing we did a conference on today. So that's what I do all day, is sit in my office and do conferences. And so there is some theoretical stuff in kids that vaccines might be slightly less effective if you take Tylenol. So kids get a lot of shots, and sometimes the parents want to give them Tylenol before, and so in a place like Aviva or Kaiser or a place like that, who gets Tylenol before they're shot and who doesn't, and then you can measure the difference. And there's a very slight difference in efficacy in kids with childhood shots who get either Tylenol or ibuprofen versus the others. Hard to know what that means, hard to know if that's real, whether it's important. And so as pediatricians, we think our kids' comfort is more important than that maybe slight decrease in efficacy. And so what we tell parents is you don't have to routinely give them Tylenol, but certainly they get fever, they get uncomfortable, or we're really uncomfortable after the last set of shots, you can give them some Tylenol or ibuprofen. So the difference on this is really at best theoretical. It is theoretical, and again, if you're feeling crummy after the shot, you should get it. There was a group of pediatric infectious disease people, and they were asked, should you take Tylenol or ibuprofen after you get the shot? And they agreed that if you feel crummy, you should. So Kat says, our pharmacies and docs are only vaccinating over 80. So we're doing anybody who's currently eligible. So for right now, anybody in Group 1A, educators, and those 70 above are eligible. I think now a lot of people signed up the 80-year-olds and are getting to them in order, but clinics are doing as clinics will do. But right now we will do that for people 70 and above. So Judy says, still can't schedule a vaccine in Reedsport. Any updates? They just got 200 doses today, and they're getting 200 more later in the week. So this would be great. So they do have vaccine. They were cautious about advertising until they knew they had it. So for people who have not been following the weather, there was this. So typically we get our vaccine deliveries each Monday. So Monday the 15th, we were expecting to get a delivery. Didn't arrive on the 15th because the 15th was a holiday for the state. So it was supposed to arrive on the 16th. Then we heard that there was weather. It didn't get on the 16th. And then it didn't get delivered until the 22nd. So the vaccines that we were supposed to get on the 15th, we didn't get till the 22nd. And places then were cautious about scheduling people because they weren't sure the vaccine was going to arrive. The vaccine that was supposed to arrive on the 15th finally arrived on the 22nd and got delivered today, the 23rd. The vaccine that was supposed to arrive on the 22nd, They tell us it's supposed to arrive later this week, but I can tell you we're incredibly gun shy. I cannot tell you how many appointments people had to cancel and move and whatever, really complicated because the vaccine didn't arrive. And I think Reedsport has been worried about having vaccines scheduled and then not doing it. But I talked with them twice today, and I think it's great. So Mick says, would you encourage those who've had 2 doses to give blood? Yeah, they're not going to use vaccine doses for convalescent plasma. And I will tell you, one of the incredible disappointments of this is a study came out this week that showed that convalescent plasma, that's plasma taken from people who have recently had the disease, which was thought to be, this is going to be great, doesn't work. And it probably doesn't work because the amount of antibodies in one person's blood is not that much, right? So that if you take my plasma, my convalescent plasma, so I go in and give blood, I give a unit of blood, a pint, 500 mils, and of that, about, depending on what your hemoglobin is, about half of that, about 250 mils, is the plasma. And that plasma has lots of things in it, including COVID antibodies. It does not have that many COVID antibodies in it, and it shows that it doesn't really work. So I would encourage everybody to give blood, whether you had 0 doses, 1 doses, or 2 doses. If you give blood, they'll do a COVID antibody test. And that's how we know what the seroprevalence is. So what we're hoping to see in Oregon is the seroprevalence before we started giving vaccines was about 4 to 6%. That's if you look at blood donors, 4 to 6% of them probably had the disease because there was not vaccine. And now we're expecting that to go up. We think we have to get to a seroprevalence of 60 or 70% to prevent the disease from continuing to spread. So Casey says, if the virus is aerosolized and not on surfaces, why do we need to wash our hands? For everything else. So the washing their hands is for everything else, E. coli and all the other kind of things that happen. But in terms of preventing COVID, probably not as important, but still, it's good to wash your hands. Do we know if the Kineville Clinic has gotten more vaccine? I think they got some today. If not, they'll get some more on Friday. And so they will get vaccine. So will the extreme range make schools shut down? So the extreme range does not make the schools shut down. Again, it's very complicated, and I would have you go into the Ready School Safe Learners. They need to prepare to shut down, but they don't need to shut down unless the number of cases is higher than it is. Now, again, that's different from the CDC. The CDC would suggest that with the number of cases at the range we have now, that schools should be just online. High schools, at least, should be just online. So Nikki says, why is it that when you have a case in your house, you count the others in the house as positive when they haven't been tested? Well, that's not exactly true. So the story is, the person who has the positive test is a positive. So we all agree with that. The other people in the house are contacts, and if the contacts stay well, they do not get counted as cases. If the contacts get mildly ill, they do not get counted as cases. If the contacts get severely ill, fever, cough, loss of sense of smell or taste, and they don't get a test, they're considered presumptively positive, and that's where the presumptives come from. And so the only ones who get counted are the people who wind up with really significant symptoms. Not a little runny nose, not a little sore throat. You have to have fever. And again, as an adult, how often do I get fever? How often do I have a loss of sense of smell or taste? It is pretty low. Galen says, if you have both doses and get COVID, is it less severe? So again, with all of the vaccine, what we see is that the vaccine is best at preventing severe disease and death. Almost all the vaccines are well over 95% for severe disease and death. They're good, but not as good at preventing symptomatic infection. And they're good, but not as good at preventing asymptomatic infection. So we think probably it prevents asymptomatic infection 50 to 80% of the time, prevents symptomatic infection 80 to 95% of the time, and prevents against severe disease 95 to 100% of the time. That's a good thing. mild disease is not all that bad. Severe disease and death is what we're really trying to prevent. And so yes, it seems that if you get both doses and get COVID, you're likely either to be asymptomatic or mildly symptomatic. That's not surprising because that's how the flu vaccine works, right? So the flu vaccine, as it works, is good at preventing hospitalizations and deaths, and is less good against preventing mild disease. So is there a concern for outdoor activities such as hiking in small groups, 6 feet apart and not wearing a mask? No, outdoors, 6 feet apart, you don't need to wear a mask. Here's the problem. Unless you're hiking there from your house, what it is, it's the gathering together in the car to get there. It's the gathering together for the hot chocolate afterwards that does it. But actually being out there being out there hiking, there does not seem to be very much disease outside. So again, going back to the NFL, so the NFL had these people wear these proximity monitors, sort of like a Star Trek-y thing, that could tell where you were in connection with others. And while they did have some cases spread, they don't think they had any cases spread outside. They spread indoors when they had meetings, indoors when they shared meals, indoors when they shared cars. So it's not the hiking that would get me, but it would be everybody gets in the van and drives there. That would be the risky thing. Or getting done and going to a cafe and having hot cocoa. That would be likely where it would spread. So do I know anything about this Saturday's Fairground event for second round vaccinations? Yes. So for people when they get vaccine, they're supposed to get a second dose 3, 4, 5 weeks later. So this weekend's second round vaccinations for people who got vaccinated on January the 30th, who are mostly educators, childcare, and early learning. So they're hoping on doing that. Gabrielle says, what about double masking? So double masking helps, right? The more protection you have, the better it is. And so I usually wear a cloth mask for usual activities. But if I had a relatively high risk activity, let's say I needed to go somewhere. I had to take a taxi to get to somewhere. I lived in the city, had to take a taxi or an Uber. That would be risky because I don't know the taxi driver, they don't know me. And in that case, I definitely would double mask. Let's say I needed to fly somewhere, I would definitely double mask. Let's say I needed to travel on mass transit, I would definitely double mask. Walking around outside, I don't wear a mask at all on my walk, so I walked a bunch of miles this weekend, pretty much by myself. I had my mask with me. And when I came around anybody, I put my mask on. But as we passed on the sidewalk, that's a very low risk adventure. But if I needed to take mass transit, if I needed to fly, if I needed to go to sit in a doctor's office where there are other people that were there, I think if I was at the fairgrounds waiting in line, I would do double masking. And so double masking just increases protection. And so remember, from the very beginning, people want me to decide that something is safe or unsafe. And there's nothing that's safe or unsafe. It's always a continuum. So you could say, well, what's the most unsafe thing I could think of? Well, I think going to a crowded bar where nobody was wearing a mask with hundreds of people singing karaoke would likely be the most risky thing I could think of. But how risky would it be? Even in the worst of time with the most disease, probably not more than 10 or 20% risky. I mean, think of all the people who've gone to bars and whatever. For the most part, they don't get infected, but 10 or 20% is pretty darn high. Think about it like driving. I mean, driving drunk in a dark time when you're really tired is risky, but not everybody who drives drunk in those situations dies. Some, thankfully, make it home. On the other hand, then you get to the super safe activities, being at home all by yourself. Again, this virus doesn't penetrate walls. That's a very low risk activity. And then there's stuff in between. And then you have to decide for yourself what's risky, too risky, or not risky enough. Would I go to a bar unmasked with a bunch of other people? No. Would I ride mass transit? Not unless I absolutely had to. Would I go to a meeting with 20 other people in a small room? No. But at the low range, would I walk outside? Yes. Would I go to the grocery store? Absolutely, with a mask. Would I have dinner with my wife? Yes, because we're sharing a household. Now, I have 2 vaccines. Would I have dinner with somebody else who who had 2 vaccines? Maybe. That's sort of in my gray area here. Would I visit my daughter? Probably. Would I visit my son? Maybe. So it would be 2 households. That's sort of at my risk range. Now there are others who clearly have a higher risk tolerance. I mean, they're the people who are at the bars on the weekends, and they have a higher risk tolerance, or these are the people who hang out with others. And again, your risk tolerance is yours. I'm not going to tell you what your risk tolerance would be, but I think I can very accurately put on the list what's high risk and what's low risk. So going to a bar, nobody wearing masks, pretty high risk. And it's not because of the bar, it's because of the activities you're doing. You're gathering, you're singing. And if you gathered and sung at somebody's house, it would be similarly risky. So school started in Bend, as teens are wont to do, and I was, when I was a teen. People would have parties, and they had parties. There were a lot of people, and 24 people got infected at a party. And so they closed the whole school, but it really caused a lot of issues. Now, had that party been at a bar, had that party been at a house, had that party been at a convention center, it all still would have been a party, and it doesn't have to do necessarily with the venue, it has to do with the activity. So again, on double masking, I would definitely double mask for high-risk activities. I don't think I would double mask for low-risk activities. I think Dr. Fauci now is doing it anytime he's on camera. Probably not unreasonable for him, because I'm sure there are people primping his hair and getting close to him and whatever, and so he double masks at those times. So that's what I would think about double masking. If you're going to double mask, the best way to do it is with a surgical mask underneath and then a nice cloth mask like I usually wear over the top. The advantage of that is the cloth masks tend to be much bigger and cover the surgical mask much better, and they also prevent some of the outflow, especially around the nose. If you're going to double mask, the fabric mask should be at least 2 layers, should have a nose clip, and should really cover kind of the whole thing. So if you see me around town with this, it comes almost all the way up to my glasses and down to here, so it does provide a good degree of that. A couple of other things here along the way. One of the most amazing things is, do eyeglasses help? Now there's a couple of studies that suggest that the number of people in hospital with COVID is much lower for glasses wearers than others. And it may be that some of this disease, which gets aerosolized or spit at you, winds up on your glasses rather than in your eyes and can prevent that. Some people also suggest maybe you touch your eyes less if you're wearing glasses. I don't know what it is, but now there are several different studies suggesting the same. So the question is, should you wear masks? I think if you're certainly should you wear glasses? Clearly, if I was in a high-risk area, let's say I didn't wear glasses, and I wear glasses just to read, but let's say I didn't wear glasses and needed to go on mass transit or a plane or whatever, I certainly would wear a pair of reading glasses or other glasses. Relatively easy to do. The second is, somebody asked me about last week about disease in cats and dogs. So I looked it up a little bit more. It is very clear that this disease spreads in humans. It's very clear that this disease spreads in macaques, kinds of monkeys. It's clear that this disease spreads in mink and mink-like animals like ferrets. It is also clear that this disease spreads and causes some disease in cats, especially big cats, so somewhat in house cats, but especially in big cats like lions and tigers. It also spreads in some mice. It spreads in some deer, and we think it spread initially in bats, although it doesn't seem to be spreading in bats in North America. So, the concern is that if it spreads in other species, unless you're going to now vaccinate all the species, that could be a reservoir of disease. In addition, in animals like mink, who are farmed in really, really close quarters, they can spread a lot of disease and could spread mutations. Okay, so a few more questions. So can I explain why a grocery store is different than a restaurant? Absolutely. So when I go to a grocery store, my connections with people, so if I could touch them and be close with it, is very, very few. So I went to the grocery store this afternoon, and I was there for about 15 minutes. I don't think I was within 6 feet of anybody except for the checker. and between the checkers, she had a mask, I had a mask, and there was plexiglass in between. So it was a short, not close, and protected arrangement. In addition, a grocery store has incredible ventilation. So when we talk about ventilation, hospital ORs are great. Actually, airplanes themselves, inside the airplane, has great ventilation, and grocery stores are right up there. I mean, think about the grocery stores. It never stinks in a grocery store because they've got really good ventilation. Very, very, very different from a restaurant. So in a restaurant, if I was seated by myself, it could be safe. But let's say I was a restaurant with 3 other people. We decide to go to have lunch. I love to have lunch with people. It now is close contact with 3 other households because in restaurants you tend to be within arm's distance. I mean, you usually don't sit miles apart. You usually sit close enough that you can talk. And it's going to be for a relatively long time. Unless you wolf down your food, you're going to be there for half an hour or an hour. And because you're eating, you're going to take down your mask. As well as restaurants may or may not have great ventilation. They tend to have much less good ventilation than a grocery store. So a grocery store, short, not a lot of contact. The contact you have is protected. There's good mask wearing, and there's excellent ventilation, versus a restaurant, longer, closer, less ventilation, less mask wearing, and that's why it's different. The other question is, why is 1 ply different than 4 plies? I mean, if you think about germs getting out, the more barriers it has to go through, the less likely it is to, less likely things are to go through. It's the number of plies, but it's also the tightness of the weave. And there are lots of people who have spent lots of hours trying to figure out the best way to do it. The best fabric is a fabric which is really quite thick and very dense. So the stuff I use is it's what my wife makes them. They're really very, very dense. So if you had a mild case of COVID, what are your chances of getting again? Less. So we know now we're sort of in this time where a number of people had the disease early on, and we occasionally see somebody who has what's clearly another case of COVID, and they had COVID before, but it's pretty uncommon. Remember, vaccine we think gives you about 95% protection. We think probably wild disease gives you 90 or 95% protection. And so if you had a mild case of COVID, you're probably about 90% protected, but not 100%. And certainly with a vaccine, you're 95% protected, which is great, but not 100%. So Diana says, is a KN95 as good as double masking? Well, I will tell you that an N95, so an approved N95 mask, is as good as double masking. Problem with a real N95, they are pretty darn uncomfortable, and there are not a lot of people who will wear an N95 all day. I think a surgical mask plus a fabric mask is close. Now the KN95 mask, so it's a capital K, little N95, is the Chinese equivalent of an N95. And approved KN95 masks, so approved KN95 masks and tested KN95 masks are almost as good as N95 masks. The problem is anybody can write KN95 on a mask, and there are so many frauds out there. So Washington State especially has tested a bunch of the things labeled as KN95 masks. Some of them are just pieces of crap, and they're not nearly meeting the Chinese KN95 standards. There are people who had cheapo little masks and they wrote KN95 on them. That does not make them a KN95 mask. There is a way to test masks. It's not easy, and we do that. So we do that for medical providers who want to check to be sure that they're N95 masks, and there's a way to do it with this hood and spray and whatever. So if you have an approved KN95 mask, and there's no way to know, actually, because as I said before, if you can counterfeit a Rolex or you can counterfeit a couch bag, you certainly can counterfeit a KN95 mask. And there are lots of disappointments. One of the incredible disappointments on this is that there's no way to know. And you would think that you could have some agency that would test your mask to tell you if this really fit. Because there's a way to test these. There's no good way to do that. And so people are really stuck on these KN95s to know, are they as good as an N95, which they could be, or are they just a total piece of crap? There's no way to know. So, and again, there's no way to know, because even the ones that you buy in the store that are marked KN95, the store has no way to know if they're good or not. The only way to know on the KN95s is that there are some KN95s that have been batch tested. That is, they take a bunch of masks, they test 3 out of the batch using the masking thing, and then say, well, these 3 pass, so all of these pass. I will tell you, the ones you get in the store or the ones you get online and whatever, most of those have not had the testing. So if you're interested in this, Washington State has some really interesting stuff about counterfeit and fraud in K95. So Michelle says, do dogs get COVID? They apparently do. There have been a couple of cases where dogs have tested positive for COVID, but they don't seem to get sick and they don't seem to really pass it. Whereas cats do get sick. We don't think they die from it. They do get sick and they can pass it among other cats. And not like ferrets and mink that do get it, do get sick, do die sometimes, and do pass it on. So again, it's really different among different animals. It'll be very, very interesting to see about the mice and deer, because there is some suggestion that mice and deer can both get it, get sick, and pass it. If that's the case, it's going to be a lot harder to get rid of. All right, well, it's 6:55. I'm getting shooed out of here. So we'll do this again on Friday. Again, if you have questions and you put them into Facebook questions at douglaspublichealthnetwork.org, we'll get to those first. But always, we like getting to the questions that people put in chat. Just a couple of suggestions. One, again, it's not where you go. It's not church or restaurants or this. It's what you do. So again, almost any activity, almost any place could be safe if done correctly. So outdoors, much safer than indoors. Socially distanced, much safer than close together. Masks on, safer than without. Singing, yelling, shouting, much more dangerous than sitting reading. And so think about those things. We are in this extreme range. It's really an uncomfortable place to be. We really want to get down to the point where we can open up again. And to do that, we can get there. Remember, this disease has an incubation period, a typical incubation period of 5 or 6 days. If we buckle down for 2 or 3 weeks, we can get down to that high range and begin to open it up again. And that's the goal. We are close here. We have now vaccinated about 9 or 10% of our population. We have a background immunity of 4 or 5%, so we're at 15%. We're about maybe a quarter of the way there to herd immunity. The weather's getting nicer. We can do more things outdoors. So what I'm asking people is to just work hard over the next few weeks and get us back down into that low range that most of the rest of the Oregon is enjoying. And along the time, people have been incredibly nice. I ran into somebody in the grocery store today. It was like, oh, thanks for everything you do. And really, there's a big team effort in getting this done. And for the most part, people have been incredibly nice and incredibly kind. So we always end by saying, be safe and please be kind. Thank you. Again, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. Thanks.